As a nurse practitioner, I often get asked about behaviors. What do I do when my person has a behavior? But the behavior that I like to talk about the most is probably one that's a little bit more frightening than most of the other behaviors that someone might have, and that's hallucinations. Because hallucinations are when someone senses something that isn't really there. It can involve sight, it can involve taste, it can involve touch, but visual hallucinations seem to be the one that is most common. And it's most common in people with dementia like Lewy body or later stages of dementia. And the reason that this can be so bothering is because your person is hearing something that isn't there, like footsteps or voices, or they're seeing people or things that aren't there, like people from their past or people that they don't know, children or babies, or maybe even animals that aren't there, that might be like at the end of their bed. And they're asking you if you see them and you don't. And it's something that's a little bit harder to respond to because your initial response is, I don't see that, that's not there. And your person is absolutely seeing that object or that person or hearing what they think that they're hearing. Sometimes a hallucination can even be a taste or a touch. They might feel like there's bugs crawling on them or that somebody has gently kissed them on their cheek. And they say to you, did you just kiss me? Or someone just kissed me or someone just touched me. And you know that's not true. And you want to initially say, that's not true or that didn't happen. But when you're working with a person or you're caring for a person with dementia, you're in their world, they're not in yours. So you have to bring yourself to their level. And there is a very specific type of hallucinating that might be more known to you, and that's called sundowning. And that is when the sun starts to set, that your person has a particular behavior where they might start acting differently. They might start seeing things or hearing things or behaving in a certain way when the sun sets. And this can be very disruptive to your schedule if you're getting your person ready for dinner or if you're getting them ready for bed. Now, what I like to tell people is, if you're working with someone with dementia and they're having an auditory, a visual, a taste, or a touch hallucination, and it's not bothersome to them, meaning it doesn't cause fear, it doesn't cause fright, it doesn't cause them to become angst, but they bring it up and they mention it to you, that's one thing. However, if your person is extremely fretful or frightful, or they're acting out or behaving out, meaning maybe they're getting aggressive or they're yelling and screaming because maybe the hallucination that they're seeing is bothersome. One of the common things that is in my practice is sometimes my patients will see burning children, and that's very frightful because for them it is very real and it's upsetting and hurtful to them. And so we want to do things that are going to correct that. Sometimes it involves just distracting them and reassuring them in other ways. And sometimes, if the hallucination is severe or distressing enough, then we need to add medications that will take away those hallucinations from the person that's having them. So people will often ask, well, how do I support a person with hallucinations? How do you respond to someone who's experiencing a hallucination? Because how you respond can make a big difference in their comfort level and their well-being. So if a person is hallucinating, then just consider these following things. Again, remember that you're in their world, they're not in ours. So offering them reassurance and telling them that you see or you are experiencing what they're experiencing if it's not harmful. If what they are seeing is harmful, then what you're going to want to do is document it, and you're going to want to make an appointment with their GP or their primary care provider and tell them what the person saw or what they sensed at the time that it happened and what they were doing beforehand, either napping or a meal or something like that, where this hallucination happened and how long it lasted. How did they react? Were they distressed or were they calm? And what words did they use to describe it? Was your person taking any medications or over the counter medications that could have attributed to this hallucination? And any relevant medical history, including their long term conditions. Again, if a person is frightened and it lasts for a really long time, then that's when you might want to seek medical attention. But if your person is not bothered by it, then acknowledge it and move on. Hallucinations are something that don't always happen, but if they're going to happen, they typically happen in later stages of dementia and are really more common in Lewy body dementia and sometimes Parkinson's disease. Just remember, don't argue with your person, because if they can't understand that that thing isn't not real, then you need to take the time to reassure them and ask them to describe what they're seeing and what they're feeling and try and put yourself in that environment.